Well, I want to talk about bovine leukemia virus, BLV. Now, BLV is not something that we've talked about for years. It's frankly something that we've ignored for years. But there's a team at Michigan State, and I want to cite that team of veterinarians, Dr. Ron Erskine, Dr. Paul Bartlett, Dr. Dan Grooms, that are just doing some outstanding work on BLV. And in fact, it's getting recognized nationally because Michigan State has now received 3 grants for BLV research, and the latest one will be on beef cattle, and we'll be working with the impact of BLV on beef cattle herds, as well as the dairy herds. But great team to work with, and what I'm going to share with you are some of the things that we've learned in the process of that research. So here's the plan for today, or the plan for this talk. BLV, what is it? How prevalent is it? What impact does it have on your herd? How does it get transmitted, and what can you do? All right? So that's the plan for talking about BLV with you. Now, just because we're talking about BLV lately does not mean that BLV is new. BLV has been recognized for over 100 years. It was first described in the 1870s. That's 150 years ago, just about. Okay, so we're coming up on the 150th anniversary of recognizing BLV was a problem in cattle. Wow, that's a long time. And it was characterized by those tumors. Tumors because it's leukosis. Right? So we're going to talk a little bit more about tumors later, but understand that they could see tumors, and therefore they identified the problem. They said, okay, these cattle have a problem. They get tumors. We don't know what's causing it, but they recognized that problem. And the other part they recognized was increased white blood cells in the blood. Okay? 100 years later, 100 years after discovering and identifying the disease, after characterizing the disease, they figured out what caused it. That's a long time. And they figured it was caused by a virus that they called Bovine Leukemia Virus. Now, one of the things I want to tell you is that it's a retrovirus. It's a retrovirus because, I'm not going to bother boring you with what a retrovirus is, but a retrovirus is going to come into play as we compare it to some other retroviruses. Okay? So it's a retrovirus with the ability to develop tumors, and it invades lymphocytes. Lymphocytes are part of the white blood cells. Lymphocytes are white blood cells. Right? White blood cells are part of what system in the body? The immune system. Okay, so keep that in the back of your mind, because we're going to come back to that point that it invades cells that are part of the immune system in the body. Now, let's talk about cattle that are infected. All right, so we're just going to, right now, we're just going to talk about, there's cattle that are infected and talk about what evidence there is in those cattle that are infected. Most of the cattle that are infected are asymptomatic. That means they have no symptoms. They're carriers of the virus, but they don't have any symptoms. They don't show us anything that tells us they have the disease, okay? But because they have normal lymphocyte counts. When we do a white blood count on them, it's normal number of white blood cells. There's no clinical signs, but we can detect the fact that they're infected with a test for antibodies that are produced by the animal against the virus, all right? And we can detect that either in serum or in milk. Antalbio uses do you analyze serum too? Okay, they analyze serum, but they also developed a milk test for the antibodies to BLV. And so they can analyze a milk sample for antibodies to BLV and determine if that animal is infected. Right? Now, by the way, and we'll come back to this later, older cattle are more likely positive. And then it's important to understand that when we talk about the disease BLV, bovine leukosis, we talk about bovine leukosis, infected animals do not become uninfected. They do not cure. There is no treatment that you can treat them with and get them over this. Right? So they become infected and they stay infected. That was 2/3 of the animals, right? 30% of the animals, a little less than a third, are what are called persistent lymphocytosis. That is, that they have a proliferation of these B lymphocytes. That is, their white blood cells have a higher count. And so we can actually look at these animals and find that these animals have a high white blood cell count. And then 5 to 10% of animals develop tumors, lymphosarcoma. That's a pretty small number. 5 to 10% of infected animals in our herds will develop tumors. And frankly, the reason that this disease was ignored for so long, and we have ignored it for a long time, was because that was the only thing that we were concerned about, was animals developing tumors. It was a small percentage, and we didn't worry about that small percentage. And so maybe you know that you have BLV in the herd. Maybe you've had cattle that had evidence of tumors. Maybe the vet came out, posted an animal, opened the animal up, and said, oh, there's tumors in here. That's lymphosarcoma. Just want to point that out to you. It's caused by BLV. Right? Or maybe you got a condemnation back from a slaughter plant that said this animal was slaughtered, condemned because it has malignant lymphoma. Right? And they say, we're not going to pay you for that animal because that's got malignant lymphoma. Right? That may be evidence that you have BLV in the herd. But frankly, other than that, we didn't have very good ways to check, and we just simply didn't check our animals for BLV. Now, if we go to that slaughter plant data and say, these are various reasons that animals were condemned at slaughter, the primary reason the animals are condemned at slaughter is lymphoma. Here it's twice as great as the next reason. So the primary reason that animals at slaughter were condemned, and it's not a very high percentage that animals are condemned, but the primary reason animals are condemned was lymphoma. So if you've had animals condemned at slaughter, and you may not remember why they're condemned, it's likely that lymphoma caused by BLV was the cause of that. Now, what are the chances that your herd is infected? Well, it's really the wrong question. That's what we've come to find out. That's not the great question at all. Because 1996, 89% of U.S. dairy herds were infected. Now, if there's 10 herds represented here today, that means 9 of the herds today are infected, and you can look around and figure out which one is not infected. And you all claim it to be that. Maybe it's you, but the reality is, it's probably not you. The odds are that your herd is infected with BLV if 90% of herds are infected. And when we look at the infection rate within the herds, the infection rate within the herds in that 1996 NOM study was 25 to 40% of cows were infected per herd. In fact, here's the breakdown. About a quarter of the herds had 25% or less of the animals infected. About another quarter of the herds had up to 30% of the animals infected, and you can see that it drops off a little bit. So it is widespread infection of herds, and then the infection rate within herds is frankly fairly high at 30–40% infection rates. So the question, are your animals infected? Probably so. By the way, if we compare it to herds in other parts of the world, in Argentina, in Japan, and Ontario, 70% of herds are also infected. So this is not just a U.S. problem, but we'll also see it is a U.S. problem with some other countries. But let's go back to this. In U.S., 1975, about 10% of U.S. dairy cattle were infected. So if we put all the dairy cattle in one barn and test them in 1975, 10% of them were infected. By 1988, that was up to 28%. It was increasing. The prevalence of infection among dairy cattle in the U.S. herds was increasing. By 1996, it was up to 41%. Now, it looks to me like there's a progression there. And 1996 was a while ago. That was almost 20 years ago. It's probably gone down, right? Well, there's nothing to indicate that that progression would have gone down. There's nothing to indicate that we would have done anything different to reduce the transmission or to reduce the increased rate of prevalence in those herds, in the U.S. dairy herd. So we can believe that as we go on in time, as long as we continue to ignore this problem, that it is simply going to increase if we continue to ignore it. And I'll say that what we've done since 1975 is ignore the problem. Now, let's look here. These are some countries that chose not to ignore the problem. There's about 20 countries that said, we're not going to ignore this problem. We think it is a problem, and we're not going to ignore it. And so they took a very aggressive approach. And their aggressive approach involved testing and culling. And so you can get rid of the disease. And you can test and you can kill animals that are positive. Now, if your herd has 41% positive animals, you're not going to do that. Right? But those countries elect to do that. By the way, they elect to do that probably before they had a very high percentage. If you have 10% positive animals, you're more likely to be able to test animals and to get rid of the disease out of your herd, as long as you keep it out of your herd. And in fact, if we go back to the 60s and 70s, in the U.S. animal health officials in this country That's why they're U.S. officials, right? But also in Canada, they weren't U.S. officials, they're Canadian, eh? They made the decision that it wasn't worth controlling because they said, well, it's tumors. And it's tumors in a small percentage of animals. Really, we don't see a reason to control this disease or to spend our efforts here. There were other fish to fry. There was other priorities. They didn't make this a priority. And as they didn't, it grew. But based on what they knew then, I may have made the same decision. But we've learned some things since then that have changed our minds about the impact of this disease. 2010, Dr. Ron Erskine did a field study. Maybe you were part of this. They sent cards out to everybody on DHI. Herds got a card, said, we're going to do a study on BLV. If you'd like to participate, just send a card back. Chelsea went out to herds, surveyed herds, 400 cow, average herd size 400 cows. The range in herd size was 113 to 6,500. Right? I want you to keep that 6,500 in mind because 6,500 is a lot of cows in a herd. So they did on those herds a herd profile. And what they did was they said, okay, a herd profile is, we're going to test 40 animals in the herd. 40 animals, the 10 most recently fresh first lactation animals, the 10 most recently fresh second lactation animals, the 10 most recently fresh third lactation animals, and the 10 most recently fresh older cows. Now, the analysis sample cost $6. If you have a 6,500 cow herd, and you do the math on $6 per sample for 6,500 cows, I don't know what that equals, but I think it equals a lot. Jillian, would you agree with me? That's a lot of money, right? $6 times 64 samples. Okay, that's a lot of money. 40 samples, we can quantify that. 40 times 6 is $240. And what they found out is not only they could save money, but they could tell the prevalence of the disease in those herds with these 40 samples. So the prevalence in these 40 cows was very close to the prevalence in the whole herd, no matter whether the herd was 113 cows or whether the herd was 6,500 cows. The prevalence in 40 samples was the same as the prevalence in the herd. So it tells us the prevalence in the herd by sampling 40 cows, the 10 most recent and fresh in each of those lactations. If we look then at the results of that study, and so they tested these herds, and there was 15 herds that were negative. 15 herds that had no disease in them, right? 15 negative herds out of 113. That meant that 98 herds were infected. And you can see the prevalence rate in those herds of BLV. And so there were some herds, actually, there was 2/3 of the cows infected. There were some herds with 3/4 of the cows in those herds infected with BLV. So this disease was very prevalent in some herds, less prevalent in other herds, and yet missing from 15 herds. So is it possible to get it out of a herd? Is it possible to have a herd today that's free of BLV? Yes, but they were probably closed herds. They were probably small herds. And I will tell you this also, BLV is not a disease of poor management. In fact, I would argue that BLV is probably a disease of good management, because the more we manage cows, we're probably increasing the risk of transmission, at least in the past. 87% of the herds were infected. The average infection rate, 20 to 40%. This is a really interesting graph. When you look at the profile by lactation, so we knew we had 10 cows from each lactation that were tested. And you can see that first lactation animals, 18% infection rate, but there was a definite step up with each lactation. There was a definite increase, a linear increase with BLV infection by lactation. As animals get older, they're more likely to be infected. Now, I want you to understand something. This is not a disease like Johne's disease. With Johne's disease, we say, oh, the calf can get infected, but we won't know about that for a couple years later because we really cannot test that animal and be assured that she's positive or negative until a couple years later. This is a disease where that animal will produce antibodies against the virus, and we can know if that animal is infected. So when we find an animal as infected, we can say she's infected, and when we find an animal that's not infected, we can pretty well know that she's not infected. Right? So it's not a case of just a lag in testing revealing what was already there. This is a case where the majority of infections are actually happening once the cow reached the lactating herd. Okay, 18% came in infected to the herd, but once they were in the herd, there was another 20%, 25% that were added to that, because a lot of the transmission occurs within the lactating herd. Again, if we compare to Johne's disease, a lot of that infection occurs as a calf, not much as a cow. This disease is different in a lot of ways. Okay? So, okay, maybe my herd's infected, but does it really have an impact in my herd? Right? So, I know, you give up, you cry uncle, maybe my herd's infected, but is there an impact? Because tumors in 5 to 10% of the animals is not enough to get me to worry about something. The answer is yes, there is an impact. And there's 3 primary impacts for your herd. First impact, and we'll talk about each of these, milk production loss. Secondly is decreased longevity of infected cows. And third is decreased health because the immune system of the cow is compromised. Let's deal with the first one, milk production loss. They plotted the rolling herd average of those 113 herds. And what they found was when they plotted the rolling herd average by the percent cows infected. So here's no cows infected, right? There's those 15 herds that were uninfected. Here's 20% herds that had a 20% prevalence rate, herds that had a 40% prevalence rate, herds that had a 60% prevalence rate, herds that had an 80% prevalence rate. And when they do the correlations on this, the line has a negative slope. Now, I know there's a lot of variability on that line, but the line is a negative slope. That is, herds with a higher level of prevalence of BLV in the herd produced less milk than herds with a lower prevalence of BLV in the herds. BLV was associated with lower milk production. Right? If we look at the Michigan data from 2010, the interesting thing is we can compare that to NOMS data, which NOMS is a national study from the NOMS data from 1996, and we actually see the same thing. They found the same result back then that we found in 2010, the slope being exactly the same. Michigan cows producing more milk, of course, than what those cows produced in the United States in 1996, but the same impact. And that impact is 220 pounds of milk per 10% of cows with BLV. That is, herds that have a 30% prevalence rate, on the average, had 220 pounds less milk per cow, as a rolling herd average, than herds with a 20% prevalence rate. If you compare herds at 50 and herds at 10%, that's 4, right? Here it is, a 40% infection rate difference, right? That's 4 times 220 pounds. That would be 880 pounds per cow less milk. Take a 500 cow herd, 880 pounds per cow. That's 4,400 weights. If the milk value was $19 a hundredweight, when I did this, milk value was $1,900 a hundredweight. In fact, it was a little higher than that. Well, maybe it's a little down from that. Okay? At $1,900 per hundredweight, that's a loss of $83,000 per year. Each year, increasing. 500 cow herd, a 40% difference between those two herds in prevalence rate. Milk production loss is costing you money from BLV. And yet, I would tell you this. I believe that milk production loss is the least reason and the least costly reason for controlling BLV and the least costly impact of it in your herd. Because listen to the next one. They followed almost 4,000 of those cows for almost 2 years, for up to 600 days. And they followed those cows that tested positive, and they followed those cows that tested negative to see what happened to those cows with time. And what they found was that when they divided out in the same herd, the cows that were positive from the cows that were negative, the cows that were positive left the herd sooner than the negative cows. And you know, it wasn't because farmers called cows because they were BLV positive. You don't put a cow on the truck because she's BLV positive. You put a cow on the truck because she's a low milk producer. You put a cow on the truck because she's got mastitis it doesn't cure. You put a cow on the truck because she's just a poor doer. You put a cow on the truck because she didn't breed back. We didn't put a cow on the truck because she was BLV positive. So what's the deal? The deal is that BLV is impacting the things that we see behind the scenes. It's there behind the scenes causing the problems that we see and that we call cows for. By the way, some of these cows weren't called, they died. There's a dose response, if you can call it dose response. Right? So the higher the level of antibodies produced by the cow to BLV, right? That is, the more the disease was impacting her, the more she was responding to the disease, then the greater the difference was for milk production, and we'll see also for culling. So if we look at just the difference between negative cows, cows who were BLV negative, versus cows that were defined as BLV low. They're positive, but they're low positive. Now your test results don't come back as low positive, right? But for research purposes, they define levels of antibodies as low, medium, and high. And so there wasn't much of a difference. The difference is 0.4% of milk production, but when you compare negative cows versus high cows, it was 3.1%. That is, the high antibody cows produced 3.1% less than the negative BLV cows. But then they looked at the data some more, and they said, you know, something's screwy about this data. There's something in this data that's telling us a story that we haven't yet figured out. And they looked at the data, and they worked with the data until they figured out something. And that was, I think that was the next, is that first lactation cattle did not show significant difference in milk production. And so all the difference in milk production was coming on animals that were second, third, fourth plus lactations. And so when they took those first lactation cows out of the data group, then the difference was 1.5% versus for low cows versus negative cows, and for high cows it was 4.3% less, or 1,100 pounds of milk less than their negative herd mates. BLV high cows produced 1,100 pounds less milk than their BLV negative herd mates. That's in the same herd. So it's not a herd difference. It's not a manager difference. It's not a feed difference. It's a cow difference. And that cow difference was BLV. The longevity issue. This is an interesting graph. You're going to look at this and you're going to shake your head for a second, but let me explain it to you. It's called a survival graph. We start at time 0, and if we had 100 cows, they're all alive right here. 100 cows, that's a 1. Okay? Every cow is alive, that's because we started with 100 live cows. But as we go across time, and here's 600 days, the survival in the herd starts to decrease, either because they died or because they were culled. If we look at the survival rate, first of all, you can see there's 4 different lines, and they have different amounts. But those 4 lines are in this order. The negative cows are here. This is the low antibody cows, the medium, and the high. So these cows, those high cows that we just talked about. And you can see that the survivability drops off much more quickly, first of all, in BLV positive cows, and secondly, as the antibody level increases in those cows. So much so that you can actually put numbers to it. Because the negative cows, we had about 60% of those cows that were negative still in the herd 2 years later. But if you look at the positive cows, the high positive cows, it was down around 40%. We lost 20%, we lost 20 more cows, or 20% more cows that were high positive cows from that herd in less than 2 years than we did of negative cows. BLV positive cows leave the herd sooner. They either leave because they died, or they leave because they went on a truck. We could put numbers to that. The low positive were 8% more likely to leave the herd. The medium positive, 25% more likely to leave the herd. The high positive, 40% more likely to leave the herd. Animals that were BLV positive leave the herd sooner. Do you think that costs you money? That costs you money. Even with high call prices, that costs you money, because that's not the reason that we breed cows, is to have them leave the herd soon. Interesting thing again. Those crazy first lactation cows that had no difference in milk production also had no difference in survivability rate. So we're not sure why, but first lactation animals are simply, they're younger animals, are simply able to overcome the impacts of this disease, but as they get older, this disease has a greater impact on older animals. Right? So understand the difference there. First lactation animals, we're not going to see a difference in milk or in survival rates, but first lactation animals become, hopefully, second lactation animals, become third lactation animals, become fourth lactation animals, and maybe beyond. And we're going to see the impact of the disease really showing up there. I talked about 3 impacts beyond tumors. We've talked about milk production. We've talked about increased or decreased herd longevity. The third, which may go back to explain everything else, is that they have a decreased immune response and a decreased health. Because, again, we said this disease infects the immune system of the cow. The immune system of the cow, just like the immune system of you, is the foundation for health. We have health because our immune system is functioning. That's where it affects these cows. And so we get a dysfunction, especially in these persistently infected cows or persistently lymphocytotic cows, the cows that had an increased white blood cell count. Let's look at some data. Dr. Ron Erskine was doing a study on J5 vaccine. J5 vaccine is used for E. coli mastitis. And so he was injecting cows at dry cows at multiple times, in fact, injecting not just dry cows, but lactating cows at multiple times to increase the titer or the antibody level to E. coli. All right? So he was doing a study on a different disease, E. coli, using a vaccine for E. coli, and he noticed something. When he did BLV tests on these cows, he noticed that the change in the titer level was different for the negative cows, that's in the yellow bars, versus the positive cows. The positive cows did not respond at the same rate to the vaccine. So you give the vaccine to the cow, and the positive cows are not responding to the vaccine as well. Right? So they have a lower titer level for BLV in their blood serum. That means that the same vaccine is not protecting the cow as well. Dr. Paul Cousins is looking at Johne's disease. And we know with Johne's disease that a cow can be subclinical with Johne's disease for a long time. In fact, the cow may not show until later in life the clinical symptoms of Johne's disease. Clinical symptoms of Johne's disease being that she starts losing weight, she gets diarrhea. Well, she gets diarrhea probably first, then she starts losing weight because she's not absorbing the nutrients in the feed. And so if she's not absorbing the nutrients, she's going to lose weight. The diarrhea is the loss of those nutrients out, and she loses water with those. That's clinical. When a cow goes clinical, she may go in and out of clinical, and then she just kind of crashes. What Dr. Cousins is looking at is cows that are BLV positive versus cows that are BLV negative, and seeing that cows that are BLV positive tend to go clinical sooner. Again, the impacts of that disease coming. So if it holds true for those diseases, does it hold true for other diseases as well? I talked to a guy at a meeting. He says, we've been doing BLV testing on all of our cows for a period of time. I forget, it was 5 years or more. But he said, what we've seen in our herd, and I can't back this up, this isn't research, but what he told me was what they've seen in their herd is that the bad mastitis cows are all BLV positive. Right? So he's seen other diseases related to this issue of BLV that we just wouldn't even pick, but because the disease impacts the immune system and the foundation for health, we're undercutting that foundation with this disease. So why is the prevalence increasing? I told you again, 1975, 10% of U.S. dairy cows were infected. 1988, I think it was, 28% were infected. 1996, 41% were infected. Why is the prevalence in cows increasing? Well, here's some reasons. Oops. We have more intensive repro programs. In the last 20 years, I don't know, I'm not good on years, So I just throw 20 out as a number, right? In the last 20 years, we have been much more intensive about repro programs where we are now using synchronization programs. We're giving more injections. We're checking cows sooner. We're checking cows often. We're doing rechecks on cows. That means we're sleeving cows. We're going to talk about that. We're giving more vaccinations. The vaccine companies have been busy. They've produced vaccines that can help us. We've looked at those vaccines and say the vaccines can help us. We're giving more vaccinations. That means more needle sticks. We're sharing feed. Now it's interesting why this isn't up there. But we do know with some other diseases that some diseases can be shed in saliva. We don't really know that yet with BLV. We don't know how much risk there is to shedding in saliva. But we know that there are diseases that can be shed in saliva and that we could actually transfer disease at the same feeder between animals just because they're licking out of the same feed trough, heifers especially. Reduced biosecurity. Oh sure, we talk about biosecurity a lot. I went to a cattle auction recently. Talked to a guy, I stood next to a guy who was buying a lot of cattle, and he wasn't using the catalog, so that wasn't a criteria for buying animals. He just would look at them. If they were producing milk, if they were alive, if they were walking, he'd buy them. And he's keeping track with tick marks on his hand to remind, or to let him know how many he bought. He had bought 75 at that point. So his biosecurity protocol for selection of animals wasn't very strong, we'll say, right? And whether or not you buy cattle, or whether or not you don't buy cattle, biosecurity is about the risk of diseases coming onto your farm that were not there before because of either animals coming on your farm, or people coming to your farm, or equipment coming on your farm that may carry the vector for that disease. Increased metabolic demands. The more stress we put on that cow, the more stress we put on that cow's immune system, the more likely she is to be vulnerable to diseases like BLV. And so these are just some of the possible reasons. But can it be reduced? That's the question for you. Can this disease be reduced? Well, one thing as we know is that the virus is unstable in the environment. This is not like a environmental mastitis. We talk about environmental mastitis and we say, well, clean cows, dry cows, do a good job prepping the cow, pre-dip, but we're not going to have less bacteria out there. Well, this is not a case where the virus is stable in the environment. It's not just out there in our stalls. It's not out there in our fields. It's not out there. It's in animals, right? So it's transferred from animal to animal. And the risk of transmission is in the transfer of infected blood cells. That is, white cells going from an infected cow to an uninfected cow. So any way that we will transfer blood, primarily blood, because we can also transfer it in milk and colostrum, and maybe other fluids, but certainly in milk and colostrum, the greater the risk that we have of transferring blood, the greater risk that we're going to transfer this disease. Let's talk about some of those ways. Rectal palpation with the same sleeve. And so when we put our arm up that cow, we pull that sleeve out, the likelihood is that we've caused enough trauma to open blood vessels, and there's blood on that sleeve, whether we see it or not. If we don't see it, which is often the case, we call it occult blood. That is hidden blood. Or Dr. Roberts at Michigan State University used a fecal occult blood kit. And she, with her third-year vet students, checked sleeves after third palpation, and 55% of sleeves that her students palpated were positive for blood. She did another study with 3 veterinarians, herself being one of those, and they palpated a single cow. And then they palpated a single heifer. And they did this with multiple cows and multiple heifers. But between the 3 of them, after a cow, 9 to 39% of them had blood on their sleeves. With heifers, it was 19 to 71%, because a heifer is smaller. We pull out of a heifer, we go into another heifer. We go into a cow. We're likely taking blood from one into another. We haven't yet shown that distinct link yet, but we know that risk is very, very high. What's another risk factor for transferring HIV? Oh yeah, shared needles from junkies, right? So we have programs in cities that offer free needles for junkies. Why? So they don't share them. What do? Well, we'll keep using that doggone needle until it breaks. We'll keep using it so it's so dull that we need a hammer to drive it in, right? Because we don't want to take the time to change a needle, or we don't want to deal with the sharps that we have to deal with once we dispose of a needle, right? But the reality is that the same reason that we don't want to share needles between junkies exists with this, that there's blood transfer on needles. Is it every time? No. But we can't see it. It's occult blood. And as we transfer infected white blood cells from one animal to another animal, we're increasing the risk of transmission to that other animal. Remember I told you that the greatest risk of transmission was in the lactating herd of cows. And so we do sleeving and we do needling between cows a lot. Natural service. Well, again, there's bloodshed in that process. And so this was an interesting study. Dr. Grooms does a breeding soundness exam clinic each year, primarily for beef breeders. They bring a bull in, they may buy a bull, and they want to breed their herd during a certain period of time each spring. And they want to check their bull before breeding season to see if the bull is ready to breed. That is, to see if the bull is fertile, to see if the bull has the capability to breed animals. And so every year he does this. We're going to do it again in April out at Chuck Preston's farm. If you've got bulls that you want to have checked, bring them out to Chuck Preston's farm, call me, I'll give you the date, location, and tell you the details on it. But one of the things that they checked one year was they drew blood samples, because Todd couldn't get milk samples out of these bulls to do his test on, so they had to draw blood samples, all right? So they drew blood samples for these bulls to check for BLV. What they found was really interesting. In virgin bulls, the BLV prevalence was near zero. In bulls that were over 5 years old, 2/3 of those bulls were infected. How'd they get infected? We don't sleeve bulls. Not much. But bulls breed. If we go back to that natural transmission, they were getting infected from infected cows in herds. Infected cows, infected bulls. Infected bulls, infected cows. It's a cycle that continued. Do you see the risk of this even if we don't see it? Another way, we do things on the farm, we handle cows in ways, or calves in ways, that transfer blood, whether it's gouge dehorning, whether it's tail docking maybe, whether it's tattooing. There's different things that we might use instruments on that would come in contact with blood, and we often don't do anything between animals. We often just go down the line of animals or put it on the shelf. We don't do anything with that equipment. We don't clean it or sanitize it, and that's another way of transferring the disease. Well, here's one. Flies. Blood-sucking flies. They can transfer disease because they can transfer blood from a non-infected animal to an infected animal. Because as they suck blood out, I don't really understand how flies work. I don't like flies at all. But I believe they suck in and they probably put something back in. They suck in and spit out in that process. It's probably not called spitting out. And in that process, they can transfer disease. And so if we look at another retrovirus, and this is an equine virus that is of horses, and it's equine infectious anemia, and we know that that's transferred by flies. So if we know that this retrovirus is transferred by flies and horses, we can say there's a good possibility that this retrovirus, BLV, is transferred by flies in cows. In fact, in Japan, they did this crazy study. They did a study where they had infected animals in a herd that were identified, and they had uninfected animals, 14 non-infected animals, BLV negative animals. And they did everything right in those herds, or in these two treatments. And that is, they used separate sleeves, they used separate needles, they did not transfer blood in any way, they didn't use transfer colostrum milk, so they were eliminating every other route of transmission between the positive animals and the negative animals, except with one group, they used fly nets and fly spray. Right. We're not going to use fly nets, but they were trying to find out if flies were an issue. In the herd, in the group where they used the fly nets, none of the negative animals became positive. because they were doing all those other, this is with the nets. None of the negative analysis became positive because they were doing everything right, and they're also using the fly control. And in the ones without the nets, 6 of the 14 became positive. So the only difference was in flies. Now this is usually a greater problem in the southern part of the United States, where fly season is a lot longer, like 12 months out, 12 months. Right? We don't have too many flies out there right now, but certainly it is a risk for us as well. Colostrum in milk. All secretions can contain the virus, and therefore milk and colostrum-fed calves are a risk factor. White blood cells. Are there white blood cells in colostrum? Yeah, sure. Right? Are there white blood cells in milk? Sure there are. Right? And so we can infect animals that way, but here's the positive thing. And when we take colostrum from a BLV positive dam, she also has produced antibodies to that disease. And the antibodies are actually beneficial to the calf. And so we say, oh wait, I want the antibodies, but I don't want the virus. So which do I do? Now before I go on to that, I don't like the order I get this in, but we can also have in utero transmission. That is, while the calf is still in the mom. It can transfer over the placenta, and we get maybe 4 to 18%, especially from those persistently lymphocytotic cows. Okay, so it can be transferred there. Let's go back to this issue of colostrum and the antibodies in colostrum and the virus. If we pooled colostrum, and I heard Faith say about pooling colostrum, okay, then we can multiple calves can get infected from individual cows, because now we pull the colostrum and one cow that was positive, and we can give that to a lot of calves. We pull that, we get calves that are infected because of that virus. But the antibody level from that cow gets diluted by the milk from negative cows, and so there's insufficient protection to protect those calves. If we treat the colostrum either by pasteurization or freezing, it destroys the virus, preventing BLV transmission. Now, pasteurization, because we're actually killing the virus, and it's what we call actually near pasteurization. We don't fully pasteurize colostrum because the temperature required to pasteurize colostrum, 145 degrees for 60 minutes. 60 minutes? Right.
145 at 30 is pasteurization.
145 at 30, that's it. Got my numbers wrong, thank you. Yeah, the next one's at 60 seconds. Okay, 145 at 30 degrees for pasteurization. What we'll do with colostrum is generally 140 degrees for colostrum so that we don't destroy the IgG. So when I say pasteurization, we're really talking about, I'll call it near pasteurization. That is our colostrum, our colostrum setting for pasteurization. It destroys the virus, prevents BLV transmission, but it protects the antibodies. They are still viable, and we can get the benefit of the antibodies from BLV positive dams. Let me go back to freezing. Faith mentioned the problem of freezing and thawing, especially she talked about the fact where we have those defrost freezers. What'd you call that? Automatic defroster. Yeah. So they go through a freezing thaw cycle. Okay. Freezing and thawing disrupts cells. Right? And that process will actually break up the white blood cells. Faith mentioned that when she talked about colostrum. And so, although it decreases the quality somewhat of colostrum, it also helps us when it comes to BLV because it disrupts those white blood cells. So here's the recommended risk reduction practices. Single use of palpation sleeves or a new sleeve after known positive cattle on all vet checks or after heifers. Right? Do something that reduces risk. It may not be an all or none situation. You may say after every heifer we're going to use a new sleeve. You may say after every positive animal, if we know which ones are positive, we're going to use a new sleeve. Or you may say we're just going to use a new sleeve after all animals. But certainly, anything we do in sleeving, individual sleeves, will reduce the risk of transferring that disease from one animal to another. Single use of needles. Again, it's a case where it's another step that we can do, another step that we can take to reduce the risk of transmission. Heat or freeze treatment of colostrum in milk, good fly control, avoid natural breeding with infected bulls, but I would tell you that avoiding natural breeding with infected bulls is only until they breed an infected cow. So we can start with an infected bull today, and by tomorrow he can be infected because he got infected from a cow that was infected. And sanitize equipment between animals and test purchased animals. Now, I want to tell you about a project. And Raymond, would you help me out? on the back table there, where the display is, the sheets that are in the center of the table, would you bring me that pile of sheets? And I think I'll have you pass them out then. Michigan State University has some grants, some BLV grants, and we have a partnership with North Star Antal-Bio to bring you a testing program for BLV in cattle. Tell you what, I'll take one, and then if you just pass them out and just you don't have to count them, just throw some down on each table. And so what this is a description of that program, and basically the program is this. The program is, number one, test the herd and see what the prevalence is in your herd. Number two, develop a plan to reduce the risk of transmission. Where? Garcon, you came through here. And number three is 12 to 14 months later, go back and check the herd prevalence again to see if you've reduced the prevalence in the herd. Right? 3-step program. I've got it in more steps. I've got 7 steps here, only because I just want to explain it fully. But basically, is those 3 steps to determine the prevalence, to work with your veterinarian to develop a plan to reduce the risk of transmission, and to recheck the prevalence 12 to 14 months later. Now, herd prevalence is determined by the herd profile. So it is not a case where this test is looking to determine for you every cow that's positive in the herd. Frankly, I don't care the identity of every positive cow in the herd. What I care about is the prevalence in the herd, and I want to follow the prevalence in the herd, because the risk reduction things I want to do it whether I think a cow is positive or whether I think a cow is negative. I want to do the risk reduction things because they're going to reduce the risk of transmission of disease. Right? So 40 cows tested to get a baseline. That gives you a baseline prevalence. But the only way that prevalence is going to change, because I said this disease does not cure, the only way that prevalence is going to change is by preventing new infections. Right? So as we get rid of infected animals and as we prevent new infections, we're going to see a decrease in the prevalence in the herd. That's going to be a slow change. It's not going to happen quickly because we can't cure this disease. And it's going to require you to make permanent changes in management to reduce the risk of transmission. When we did meetings about Johne's disease several years ago, we talked about permanent changes in how you manage calves. Because unless you were willing to make permanent changes, we didn't want you making those changes, because you just can't get into something and get out of it, because the disease will come back. BLV is the same way. Unless you make permanent changes, the disease may decrease in prevalence, but then increase in prevalence later. And so we talk about make changes that you're willing to keep permanent. Now, we want to recheck the herd in 12 to 14 months. Is this enough time? Frankly, we're not sure. We had debates about this. When we developed this program, we sat around the table with Todd and Bridget from Antal-Bio and Dr. Bartlett and Dr. Grooms were there, and we talked about what kind of time to go back and recheck the herd. And what we thought was 12 to 14 months will at least keep you interested in it and give you a guidepost to tell you if you're on the right track. But what we really like to do is we like to check the herd 5 years later. But if we just said we're checking 5 years later, you're going to forget about it, I'm afraid. And we might forget about it, I'm afraid. And so we want to check it in 12 to 14 months to see if we're on the right track. Now, because of the partnership with North Star Antal-Bio, and because of grants from Michigan State University, we're offering this program at half the cost. The cost of a test is $6 per sample. 40 times 6 is $240. The cost of the program is $240, but you get 2 tests for that. You get the first test to establish the baseline, you get the recheck test 12 to 14 months later, and you get the work in between to help you reduce the risk. So it's not a free program. You're not signing up for something free, but if you're interested in this program, what we ask you to do is to fill out both sides of the sheet. There's a small risk assessment here. We ask you about the name of your veterinarian, because we're going to work with your veterinarian, and on the back side, there's a place to sign and to check off that you're willing to have things, have money billed to you, actually. North Star Antal-Bio is a partner with us on this. If you are a DHI customer, they will identify the animal. You give these sheets to me, I send these sheets to them. We'll work with your tester to identify the animals. Remember, the herd protocol is very specific, about 10 cows, most recently fresh, of each lactation. They'll identify the animals. They will identify those samples for testing back at the lab. So you don't have to do anything. And then they'll bill you. It's great. They do all the work. They just give us the results, right? So they will bill. If you are not a DHI member, we still work with North Star DHI, and what they will do is supply 40 sample tubes for you. I believe you will take the samples, then you will send them to North Star DHI, and they will still bill you. Okay? So you can participate whether or not you are a DHI member. BLV is difficult to eliminate from herd. That change comes slowly. It's not a short-term fix. It's about changing the way that we do business. But the benefits of increasing the percentage of BLV negative animals, that is, reducing the percentage of positive animals, increasing the percentage of negative animals, should be greater longevity of cows, increased milk, and a decrease in diseases and problems. So in summary, how likely is it that your herd is infected? Very likely. But at what prevalence? I don't know. It's going to be different for every one of you in the room. And there may be a herd in here, maybe even 2 herds in here, but I doubt it. They're uninfected. But we're not going to know that unless we check. And it's likely that practices on the farm that you're doing today facilitate the spread of that disease. So we want to identify those and reduce those practices. And as a result of that prevalence, milk production is negatively affected, cows leave the herd sooner, and your animals are not as healthy because their immune system is compromised. And though it's difficult to eliminate it, we can control this and we can reduce the prevalence in herds. You know, we ignored this disease for a long time. I think we ignored it too long. But now that we know the things we know, it's not time to ignore it any longer. We really need to take action against this disease. What kind of questions do you have?